Welcome back to Healthy Mind, Healthy Life. I'm Yusuf, and today I'm joined by Dr. Khashayar Farzam, a Canadian emergency physician, board certified in both Canada and the United States, with a clinical focus in obesity medicine, men's health, testosterone related care, and body composition. He's also a powerlifter for Team Canada with multiple Guinness World Records, which gives him a rare lens that blends evidence based medicine with real world performance. Today, we're cutting through the noise around testosterone replacement therapy, the myths, the misconceptions, and the question many men quietly carry, but rarely ask out aloud. Should I actually be checked? With that, I welcome my guest, Dr. Khashayar Farzam, to the show.
Yep. Thank you for having me.
Absolutely. So, Dr. Hash, before we go into the clinical side of this, I want to start with something simple. So, when a man walks into your clinic and says he just doesn't feel like himself anymore, so what does that conversation usually open up?
Yeah, that's a great question because we actually see that exact same patient that using those exact same words on a daily basis, multiple times a day. And so usually the conversation first starts with me checking and seeing like what's going on, how long have they been feeling like this for, what their
Mm,
specific concerns are, like are they feeling tired or something different about like their lifestyle, is something changed with their medical history, so that we try to pinpoint the exact cause. And that's
mm,
really the initial point is you want to figure out what changed suddenly. Did this start last week? Did this start a year ago, 6 months ago? And we want to find out why this happened. So when and why is very important because
okay.
then we take the next steps into doing some diagnostic testing and really figuring out the why before we act on it.
Mm, see. And testosterone has become, one of the most talked about and most misunderstood topics in men's
Yes.
health. So,
Yes.
from your seat as physician, what's the single biggest myth you keep hearing?
Oh yeah, that's an amazing question. So there's like I would say amongst the this is a probably very prevalent amongst the entire medical community internationally. So
Mhm.
multiple, I would say the entire risk profile, all the possible adverse effects. There's huge misconceptions around that, and so I would say the fact that they directly cause heart attacks, they cause prostate cancer. These are probably some of
Mm,
the biggest misconceptions that we see, and we have very good studies now. The Traverse trial a couple of years ago, for example, and newer data showing that testosterone replacement therapy, when done appropriately under medical supervision, then it does not directly cause prostate cancer. It does not cause heart attacks. We know that patients who have very low testosterone can have poor health outcomes. And I
mm,
think the medical community also, at times, there's too much of an overlap between people who use it for performance enhancement reasons, which is completely different, and people who use it appropriately within the medical realm and medical parameters. And so I think the entire world of the software replacement therapy at an international level, we see a lot of misconceptions about some of the risks. Now, there are risks, of course, like with anything, there are some risks, but
mm,
some of the specific things that come up repeatedly often are from, several decades ago, poor quality evidence, things that have just been repeated over the years. But we know now from new studies that some of the traditional things that people thought the software replacement therapy can do, it does not cause those things.
mm. Okay. And where do you think these myths come from? Like, is it social media, locker room talk, outdated medical advice you already mentioned? So, or are all the three things that I mentioned are enforcing each other?
Yeah. Yep. So yeah, the locker room one you mentioned is very interesting. It's very accurate. So for a lot of the conventional things that some people learn about the topic of testosterone comes from the the bodybuilding community, especially from, I would say more specifically in the 1990s into 2000s. 2000s, especially when, obviously the 90s to 2000s, the internet came, right? So
Yeah.
then we got an explosion of information everywhere, easy accessibility. So a lot of the people in the bodybuilding community, a lot of their personal experiences with using anabolic steroids and performance enhancement agents and dosing, their personal experiences, so specifically their personal side effects, I should say, became very well
Mm.
known online. And a lot of the current practices and current knowledge base, some of it gets downloaded from those individuals. So we get too much of an overlap between medically prescribed testosterone replacement therapy and performance enhancement. And it's just two different worlds essentially, right? I mean, yes, it's same drug, same medication, but it's just two entirely different worlds in terms of what they can do to the body. And certainly there's outdated literature, outdated evidence too from several decades ago that's been repeatedly, refuted and disproven. But it
Mm.
still lingers in the background, unfortunately. So I think it's important we use the best quality evidence that we have, the latest evidence that we have to sort of guide what we're doing.
Okay. And I think that is important to name because once a myth gets repeated enough, men start making decisions about their bodies based on the rumor instead of evidence.
Exactly, exactly. And we
Mm.
get some person in the gym might say something and then they go on social media and then that particular myth can now fall out everywhere, right? So,
Mm.
same thing with sometimes we see a study that one study, let's say, gets done without good quality or has some flaws, but it shows an outcome that is not ideal. Now that study then gets repeated by everybody in the medical community. So I think we need to have good quality evidence to guide what we're doing. And with testosterone replacement therapy, like we know that it's when it's done appropriately for the right patient, correct diagnosis,
Mm.
correct treatment, we know that overall it is relatively safe. There can be some side effects that can lead to elevated blood pressure in some cases. It can, there might be some very marginal blood clot risks, but mostly if the protocol and follow up is not correctly implemented. And then there's things like hair loss, acne, things like that. It varies case by case, fertility and whatnot. But a lot of these are very case by case basis and they vary from individual to individual. And having a correct protocol for the treatment is the difference between someone who experiences very little side effects and someone who experiences a lot of side effects.
Mm. Okay. So, Dr. Cash, who should genuinely be considering getting their testosterone checked? Because the popular answer right now seems to be everyone.
Yeah.
And I'm
Yes.
guessing the clinical answer is more nuanced than that.
Yeah, so I would say there's a two. I would say two answers for this. The first answer, I would
Mm.
say um, anybody who has some of the symptoms of low testosterone, which can be a sudden change in mood, but without depression, poor sleep, loss of muscle, increase in visceral fat, decrease in libido, decrease in drive. A combination of these symptoms that come on somewhat suddenly, it can indicate that
Mm.
somebody potentially has, I say potentially, very important term there, potentially low testosterone. And that would be a reason to check. There's a second answer though. And this one is a little more theoretical. And the FDA recently had a hearing couple months back, and their guidance was that this was an expert panel, and there was a lot of academic physicians on there, academic urologists, endocrinologists. So it wasn't like they're
Mm.
they're not working for the FDA. These are just academic physicians around the United States, all with years and decades of experience and research in this topic. And there was a pretty strong consensus amongst this panel that perhaps men should potentially obtain a baseline level of testosterone at some point. There isn't a specific age recommendation because we don't have the evidence for it, but perhaps when they're before their middle age, maybe somewhere in their 30s or age 40 or something like that. And the reason that might be a good idea, and it's not a recommendation, this is not something with good evidence for it yet, but perhaps obtaining um, you know, uh, having a baseline level at a certain age. I'm just going to say 40 because they're hypothetical. Then when the patient comes back when
Mhm.
they're 50, now they have these symptoms. So we have a level to compare to and say, this is where you were before, this is where you are now. And we know that you had a big drop. Or you have not had a drop, you're the exact same, or it hasn't changed much. And so that's a theoretical recommendation. I think that needs evidence to be an official medical recommendation, but it's very interesting to potentially have a baseline level to compare to. But I think the general answer still is somebody who has symptoms.
And that is a crucial distinction because not every tired, low energy day is a hormonal issue. Sometimes it is sleep, stress, or burnout wearing the costume of something else.
Exactly, exactly. Yeah, and many cases, patients feel tired. They have some mood changes and lack of motivation, and it turns out, yeah, they're not sleeping well. They have sleep apnea, or they have something else going on, or they're not eating well. They're under a lot of stress, and stress can also lower your testosterone a little bit too, right? But at the same time, the main cause in that patient's case would be the stress. And so, yeah, there's lots and lots of non-hormonal related reasons as to why somebody might feel the way they do, which, maybe they don't feel as good as they did last year. And there's can often be many lifestyle related reasons to explain that. It's a very good point.
Yeah. And let's say once a man does get tested and the numbers come back low. So, what does responsible TRT management actually look like? Because there's a wide gap between proper clinical care and what some men are doing on their own through online clinics or unregulated sources.
Yeah, exactly. And I think in our practice, we'll get the once we have confirmation somebody has low levels, they have symptoms, we decide we want to do treatments. We've done their secondary tests and ruled out other causes of low testosterone. Once we start the treatment process. So usually I present options to patients, and there's different modalities. There's injections, there's topical agents, there's pills. There's been other things too over time, like pellets and nasal gel. In Canada right now, where I am, we don't have
Mm.
the um, greatest accessibility to those things, but that's okay. But generally, once we pick a modality that works for the patient, I mean, some people are very comfortable with injections. Some are not at all. Some people want cream. They live alone. Nobody else is going to touch it. So some people want
Mm.
pills. But regardless, we pick a method that works for the patient. And generally, what we do is we start them at a reasonable dose, which is obviously what I would describe as a medical like TRT range dose, where the goal is to raise their testosterone levels, obviously, and raise them into a healthy physiologic range. And we implement the protocol. We check their levels after a couple of months and to make sure the levels are in an appropriate range. We check to see if they feel better, if they have any symptoms. We monitor things like blood pressure, and then we do other blood tests. For example, to make sure their blood's not getting too thick, their cholesterol is okay,
Mm.
and so on. If there are any minor issues, then we tend to make some tweaks and some changes and adjustments to account for those things. And having close follow up after a couple of months is very important to make sure we're catching on to those things. So rather than giving a prescription and saying, good luck, we'll
Mm.
see you next year, kind of thing. In contrast, like you mentioned, to people who just do it themselves. Yeah, the issues you run into is, maybe your blood's getting too thick, your blood pressure is going too high. Maybe your
Yeah.
cholesterol is going in the wrong direction. I mean, these are all things that can happen very quickly when someone is not being monitored. And that's why having like that, we can call it medical supervision and call it, medical appropriate TRT, but having that proper plan in place. In my practice, we have very, very few patients who run into any major, honestly, into any issues at all. I would say, you know, 99% of the time, the very tiny little tweaks, things we catch, we can make a tweak and make adjustments and prevent it from getting worse.
Mm. And that is important for listeners to hear clearly because the cost of getting this wrong isn't just wasted money. It is your body, it is your biology that does not always forgive shortcuts.
Yeah, exactly. Because yeah, that like testosterone, they can get it. It's not too expensive compared to some other things out there. But ultimately, if you miscalculate and you do it incorrectly, I mean, yeah, you can certainly end up with, if you're taking too high of a dose, lack of monitoring, you can end up with a blood clot unexpectedly. You can have high blood pressure that's damaging your kidneys, for example. All these things can
Mm,
happen, which had things been done correctly, it would have been caught very soon by the physician. And I think that's why having that, you know, in-person assessment, having close follow-up is very important for these patients.
mm. Yash, you sit at this rare intersection of emergency medicine, obesity medicine, and elite performance. I want to know what is something you have come to believe about men's health that the wider conversation has not quite caught up to yet.
Yeah, I think because in our practice we do weight loss medicine, of course, as well. And so, in the emergency side of things, in the emergency room, I see patients with acute issues, and some of these cases
Mm,
have acute illness that from something that could have been prevented. And so when I do my weight loss, metabolic health, men's health medicine side of things, I'm essentially working to prevent patients from having to need an emergency room, essentially, right? And
mm,
through my experience in powerlifting, I compete to, drug tested. Our federation's WADA drug tested, and so everybody is substance free. And so, regardless, through the years of doing the sport, you're going to have interactions and so on with people who use performance enhancing agents. And so that's where you sort of learn and you sort of triangulate these things. And what I see is that a lot of these patients who end up in the ER from various reasons, they end up having things that are preventable. And that's what I strive to do. And on the clinic side of things in my clinic is to prevent patients from developing any acute illness.
mm. And how do you talk about this with men who are, skeptical of medicine or feel their concerns haven't been taken seriously by other doctors?
Yeah, it's definitely something we run into quite often. I mean, some people say, well, I've been to other places and I've asked to get checked and I have these symptoms and, they didn't want to check. And that does happen. I know different physicians and so on sort of practice within their comfort levels and training. And something I've strived to do, I provide e-consults to physicians. And so I strive to provide education. And I think obviously there's room to learn more. But I think for a lot of these patients, usually sit down, we have a chat, we see what their exact concerns are. I try to find like pinpoint a cause as to why they feel the way they do. Yeah, many of them feel like, and some of them not necessarily with individuals in the past, but they feel like the system hasn't been as helpful for them. But I think it's really just a matter of hearing their concerns, seeing what they think, and making sure they feel heard, and then we just go from there.
Yeah. Dr. Cash, for people who might want to connect with you or want to learn more about your work, where can they do that?
Yeah, so if they go on truenorthmetabolic.com for anyone in Canada, we're in Kitchener, Ontario. And so we
Mm.
do in-person consultations, and then we have the option of doing virtual follow-ups for patients who've been to our clinic, and we serve patients from all around Ontario. We have many patients from many hours away that come and see us. It would be truenorthmetabolic.com.
Perfect. And to everyone listening, all these links are in the show notes, so just go and check those out. Is there any last message that you want to leave us with?
Yeah, I just think that if for anybody, if you have symptoms, don't be afraid to have a visit with your physician and inquire about it, and see what they think would be the next best step for you. Just don't be afraid to go in.
Thank you so much, Dr. Cash, for coming and blessing us with your presence and your knowledge and your unique take on the medical advice and TRT. Thank you so much, sir.
Thank you.
And to everyone listening, quick and important note before we close. Because tonight's conversation was educational, not a medical advice. So if anything you heard resonates, take it to a qualified physician who knows your full picture. Don't diagnose yourself online. And please don't medicate yourself based on a podcast. Use this episode as the nudge to ask the question, not as the answer itself. This has been Healthy Mind, Healthy Life. I'm Yusuf. Take care of your mind, take care of your body, and I'll see you in the next conversation.